So welcome back everybody to the second half of the Partnership Board meeting. Our next item focuses on our ambition to have a more diverse leadership, and particularly the follow-up evaluation to the independent race review that was carried out in 2020. So I'm going to hand over first of all to Fatima Khan-Shaw to introduce this item.
Thank you, Chair. Good afternoon, everyone. For those of you that I have not had the privilege of meeting before, my name is Fatima Khan-Shaw and I am the West Yorkshire Inclusivity Champion. And we've got your attention, I think, for about 40 minutes, and you will definitely get your money's worth, I can assure you. This is an agenda item with sort of two halves. One will be an evaluation of the review indicated by the chair that has been led by an independent chair known as Professor Dame Donna Kinnair, who's joining us shortly. But before we start that, I thought it'd be really helpful to hand over to my incredible friend and colleague, Sarah Smith, who's just going to talk us through a little bit of some of the data that was utilised as part of the evaluation, just to set the scene. And I can see that Professor Dame Donna is on the call as well. Welcome, and thanks for joining us. Over to you, Sarah.
Thank you, Fatima. Ali, could we have the slides up, please, while I do some introductions? Is that okay? Thanks, Fatima, and thanks to everyone who's been involved in this iteration of the review as well, and particularly to Ali's support, and thanks for the slides, Ali. So we're going to start with a bit of the data, but I just wanted to be clear, really, we sort of informed the intelligence of this part of the review. So this is kind of 4 years on from the first review, which had the privilege to be involved with as well. And what we wanted to look at was where have we come from since the last review? How have things changed, both in terms of population and health and care services, from the perception of our public as well, within West Yorkshire. So we did some work as part of the review on the intelligence, but also the data and also the insight. So each of the review sessions that we had, we presented some of the data that was relevant to those recommendations, but we also heard from lived experience that was really important. I'm just going to cover off, because you've got lots of intelligence in your pack, some of the key bits of data that I think are useful to share as part of the discussion. Before I get into this slide, I think what's been handy since the last review is that we've had a census, so we've got some data on how sort of population overall and the demographics in West Yorkshire have changed. So we've had an increase in the population of West Yorkshire who identify as being from an ethnic minority since the previous review. So now 23% of the population report being a minority ethnic group, up from 18% from the previous census. And that varies across West Yorkshire. So Bradford has the highest proportion as well. So, and that makes up 39% of the Bradford population. And that's really interesting and useful to note for when we're kind of planning services and really thinking about what the outputs of this review mean. So with that in mind, I'll come on to this next slide, which is around deprivation. The reason I wanted to share this was around we've lost one of the slides, Ali, was around the intersectionality between ethnicity and other characteristics that impact on how people access health and care. So you can see from this slide that 42% of people who identify as being ethnic minority also live in the 10% most deprived neighbourhoods in West Yorkshire. That's really important when we're thinking about how people access health and care services, because we've got an overlay of inequalities people might experience from being from different ethnic backgrounds, but also from deprivation as well, and really draws on the previous conversations we had around determinants of health, so things like housing, safe access to work, and how they access health and care. So this has kind of formed some of the intelligence that's informed the review this time around as well. So next slide, please, Ali. And what we did was we looked at the data across the life course. I'm not going to go into lots of detail in this slide. And like I say, there's lots of information in your packs that backs this up. But we really wanted to show actually there are inequalities across different points in the life course in West Yorkshire. So by that we mean inequalities from when you're pregnant, for maternity services and maternity care, inequalities for children and young people. So here we've touched on asthma admissions that I think Simon will pick up on as well later in the board meeting. Inequalities in young people and younger adults' mental health. So particularly here, if you look at detentions under the Mental Health Act, over twice as more likely for people from Black ethnic groups compared to white ethnic groups. And then sort of later on in adulthood, we've got inequalities in relation to hypertension as well, and the number of people who are sort of treated to target. And then also actually when you look at life expectancy, we've included some data here on Gypsy and traveller populations. I think that's really important to pull out in terms of ethnicity, because this is a group that experiences the starkest inequalities we see in relation to ethnicity. So people from Gypsy and traveller background are 3 times more likely to report living in poor health and have much lower life expectancies than the general population. So all of this data we took into account, and what we really wanted to focus on was what difference can we make for our workforce and our population. And we looked at our 10 big ambitions for a health and care partnership. So we looked at the data for each of these ambitions. What we're working towards is having a deprivation and an ethnicity metric for each of these ambitions for our integrated care board to focus on, so we can really influence that strategic decision making process into reducing inequalities in relation to both deprivation and ethnicity. I've included some data here on maternity because I think that's an area, particularly the VCSE Voices panel that informed this review, are really interested in us focusing on. And what we're looking at here is the things that are within our gift to influence the health and care partnership. So we know we see inequalities in the time in which in a maternity pathway people present in our system, and that is something we can do something about. So I'll move on now, I think, from the data to some of the recommendations. So Gav's going to come in and give us some of the progress that we've made since the last review, and then bring in Dame Donna to focus on some of the recommendations. So over to you, Gav.
Cheers, Sarah, and thanks, colleagues, for having me on the call. So my name's Gav Phillis. I'm Senior Programme Manager for Inclusion Health, and I was brought in on this review evaluation to offer some support and get things going. So we convened the original panel and added some additional colleagues where needed, and we asked each theme lead to report back to us on the actions taken against their initial recommendations, the progress they made, any challenges that they faced, and then any potential next steps. And we were able to have some really deep conversations within the panel there, conversations about the work that had gone on and the success that we'd received that had happened over the last few years. We heard from some colleagues and partners from across our systems that had the lived experience of some of those changes that had been put in place, and they were real powerful testimonies, but also motivating for us as a system to go and achieve more. And I think a key theme and a key word that came out of all that was how we build trust with these communities and move forward for that with them. So if you could just move on to the next slide, Ali. As part of the review process, we asked each theme lead to present us with some of the progress that they've made, and there'd been lots of achievements across the last 4 years, and it was really insightful to hear and really pleasant to be able to reflect on those successes as well. And what we wanted to do today is just to bring a few of those to life, and this is not by any means all of them. So over the last 4 years, we've been able to establish the strategic, the West Yorkshire Strategic Race Equity Equality Network, which aims to provide strategic race leadership on behalf of the West Yorkshire Health and Care Partnership. In 2023, we became the first partnership of sanctuary in the country for going above and beyond and welcoming people seeking sanctuary. We've developed an inclusive recruitment toolkit and implemented that as well where possible, which is a selection of resources to support the creation of our inclusive recruitment process. We've delivered on the Root Out Racism campaign that encourages us all to better inform ourselves of anti-racist behaviours and practices. We've also really, as Sarah just mentioned, improved our ethnicity recording across both primary and secondary care. And I think part of the next steps is then how we utilise that data better to make better decisions. And we've also got bespoke programmes within our systems now and work streams such as the Inclusion Health programme. I think throughout all that, recognising the success we had, there was also a real realisation that we've still got further to go. And with that, I think I'll bring in Kenise to give some from her perspective as well.
I'm Kenise Khan. I'm the chair of the VCSE Voices panel. So firstly, I'd like to say how proud we are of the progress that we've achieved so far over the last 4 years and the partnership that the whole partnership has achieved. I'd like to thank Dame Donna for coming to review the review and all of the team. So Rob, Fatima and everyone else that have been leading the way on this really important agenda. It takes a lot of courage to do this work, and we don't underestimate that. Where we'd like to go, we've seen the improvement on all 4 areas. There are some new areas that we're requesting the partnership to think about, and they are the maternity and mortality outcomes. The maternity is the baby's dying, the mum's dying, and with mortality outcomes, there's a specific area that we're asking for. It's the palliative end of life care. We've had a lot of feedback from community on palliative and end of life care with the acute trust, as well as, but not limited to the acute trust too. So with them and beyond that as well, through the lens of ethnicity. With maternity outcomes, we've started collecting the data, as Sarah's mentioned earlier. With the palliative and end of life care, we need the data to find out what's happening in the first place, to see if what the communities are coming back to us and telling us, is it a fact? Is this what is happening? Is the data saying what the community's experiences of palliative and end of life care? Is it matching? And then we'll take it from there. We are reaffirming a commitment to work towards a consistent approach to race equity across the whole of the partnership, the closest that we can get to communities as possible, with a focused plan of delivery alongside effective implementation of governance, leadership and accountability at all levels, including at this partnership board. We're requesting that we continue what we've been doing and don't lose momentum at this moment in time, simply because of the cuts and the dire straits that our systems are in at the moment, and through no fault of their own. But it's really important that we keep the eye on the ball on all of this agenda going forward. Thank you.
Over to you, Dame Donna.
Okay, so I wanted to start off by really, really thanking the Partnership Board for the work that they've done. And it's a rare occurrence where you see such commitment and candour and honesty in terms of working to build trust in communities, but also everybody bringing their bit to the agenda to help us make the whole better than the sum of the parts. So I really wanted to thank everybody, because it's been a huge joy to see how much work has been done since I did the review. And I know you did a review a year later, but actually just to see the progress has been astounding. And I'm sitting here in London at the Race Health Observatory Board, and they're making a lot of noise in the background. So I hope it's not disturbing you. But what I wanted to encourage us to do is to maintain that strong profile and that focused agenda. The world is changing, not least what we saw yesterday, but that will soon affect all of us across the globe. So the globe, we said this last time. We started this at the end of the death of George Floyd, and since then there has been so much change, and not least do we know that more change is coming, given what we're witnessing in world events. So I think there is something about how we keep this profile strong, how we remain focused, and how we're really clear about how we effectively implement governance, leadership and accountability at all levels. It can't just be top down, it's got to be bottom up across everywhere. I really, as Kenise said, really want to urge us to continue to listen to the VCSE voices and the concerns, and absolutely a look at maternity and mortality, because actually once you've raised it, we have to look at it to make sure that it's sound on our watch. I think that signing up to the Fair Work Charter and supporting its wider rollout is essential, because we actually know that one of the lens of inequalities is not just the race, but also the social issues, the intersectionality with what people are earning, who's in work, who isn't in work. And in fact, to lift this up, we're going to have to do that work together. So the signing up to the Fair Work Charter has got to be important. And then again, you know, embedding cultural competence, training for all staff to meet the needs of our diverse population. There's no excuse in 2025 that we are not aware of other cultural issues and that we don't make the effort to be curious and understand them. But more importantly, unless we understand them, we can't create services to meet some of the needs of our population. I think it's important that anti-racism leadership is a component part of all we do, not least because it sometimes hinders the ability of people to access good services. And it does lend itself to some of the structural issues that we face in our setup. You know, some of the systems that we've got weren't created for all sorts of people that use those systems now. And then I think that we do need to think about how we endorse and get colleagues to support and deliver, but not just colleagues, our communities, because it's you know, this is all about how we serve our communities. And actually we'll see if people feel emboldened to actually know that we need to deliver on these recommendations, they will hold us to account and they will make sure that we do the things that we're going to say. So there was lots that we covered and there's lots that we haven't covered throughout this whole review. And we've made a brief note, so we didn't have the opportunity to explore many of the things. And when we talk about racism, it includes Islamophobia and anti-Semitism, and we know some of the riots that we saw in October 2024. It was rooted in some of these racist views. The impact on long COVID on children and young people, but more importantly, as I said before when I started off, the effects of poverty and social status and actually income in those communities. So there are a huge amount of issues that warrant consideration for this partnership board in future discussions. And actually, it will be an iterative process. You know, we won't stop. There'll never be a day when we won't find something that we can improve on. But I've got every single bit of confidence because it has been a real pleasure to chair this review, knowing that there has been such vast commitment to listen to the voices of our community. So I really wanted to be here. I'm going to be here for a bit longer, unless they lock the doors on me. But please make sure that everyone feels a part of this journey. And these are my asks of you as a partnership board.
Thank you, Dame Donna. If we could stop sharing, Ali, Chair, with your support, and we're going to pause there briefly for just some reflections or questions before moving on to the equity and fairness strategy, because I'm mindful that Donna's only got a limited amount of time with us, if that's okay.
Yeah, thank you. Yes, it would be good to have a few comments and reflections on that. And can I just say, first of all, a big thank you to everyone who's worked on this, but particularly Dame Donna, to you for your role on the original review and the evaluation. It's tremendously appreciated. And as you said, it couldn't be a more important time for us to restate our commitment here, not just with what's going on elsewhere, but having seen, you know, before July, we were starting to see government voices questioning the NHS's commitment to diversity and equality and inclusion. And there's what's concerned is not just the challenge that we're seeing from voices in our society now, but the tone in which some of those challenges are being voiced as well. I better not say more without getting too political, perhaps. But so I'll could I welcome Tracy to come in first, please, and then Helen.
Thank you, and thank you so much to the partnership and to Dame Donna. Your leadership is admirable and really gives us all pause for thought about how much more we can do and how much further we can go. And certainly the impact on diverse communities during COVID gave us all pause for thought, didn't it? That we can't just sit in our hands and expect the world to be better. We have to actually make change. So thank you for your direction and your leadership. So I do hope that we've also got a positive good news story to tell. In our growth plan, inclusion, equity, and diversity is at the heart of that. You may know, Dame Donna, that Alison Lowe, my Deputy Mayor for Policing and Crime, has been driving powerfully about inclusion and diversity in the police force, but also their response to communities as well, and the communities that they serve. Obviously, that contributes to well-being. If you're being harassed every time you go to the shopping mall because of the colour of your skin, that impacts on your mental health. And I think we have to, as mayors, we have the opportunity to tackle this from a number of angles, whether that's housing, whether that's who accesses skills training, whether that's transport, who can get to jobs and opportunities. All of that, that big picture is obviously we're going to be making decisions based on this work. Also, I'm really pleased that we are the first combined authority to sign Unison's anti-racism charter in 2023, and we hope that that will be an inspiration to other mayoral combined authority. And as you mentioned, the Fair Work Charter, I'm really hoping that taking an approach that come in, the water's lovely, rather than sort of draconian, you must do this, you must do that. I'm hoping that we can build a movement here in West Yorkshire that is inclusive and that is about identifying the inherent racism and the patriarchy and also the exclusion that is felt by people with a disability, and to your point about intersectionality and the outcomes for people with a myriad of challenges. So thank you from me, from the bottom of my heart, because it's certainly something I've taken seriously since I became mayor. And in our organisation here in the Combined Authority, we have 850 colleagues. And I have seen over the last few years, with the heft of everybody putting their shoulder to the wheel, that we have also changed our organisation to some degree to make it more inclusive, more progressive, more diverse, and more reflective of the community we're here to serve. And also, just finally, Fatima, on this call, you really have helped me in my thinking about what more we can do. And Kenise, your connections to the VSE sector and the individual's voice has been invaluable. So it's a collective response, and hopefully we can have a speedier, better outcomes because of our commitment to change. Thank you, Tim.
Thank you, Tracy. Helen?
Hi, good afternoon, everybody. I'm Helen Rushworth, Chief Executive of Health Watch Bradford and Districts, but I'm here representing the health watches across our system. An observation and I guess a couple of asks, really. Thank you so much for sharing the strategy. It does look great. We're particularly pleased to see that the strategic objectives align with people's feedback from our West Yorkshire Voice workshops. I think it was particularly objectives A and J around listening to people and communities and making real changes based on that feedback, but also having processes in place to make sure that the impact actually happens and that there is accountability. Those are the themes that came through really strongly from those workshops. And also people said that they wanted the strategy to lead real tangible actions that they could see change from, and they want people to be involved in what happens next, which I think then brings me on to my next point around, I think we often see EDI as something that happens over there, not necessarily everywhere. And Sarah's slides, pointed to that perfectly, I think, in that some of the percentages of people, certainly from Black and minority ethnic communities within our place, within all our places and our system overall, the EDI it isn't something small, is it, in West Yorkshire? It's everybody. And we do kind of be concerned sometimes that it is seen as I say, pigeonholed, and it shouldn't be. How does EDI work for everybody? Because we're in such a diverse range of places. So how are we going to make it accountable? We can sign charters, but you know, whatever happened from signing the charter, I guess, Magna Carta aside, you know, it's about reality and holding each other to account, isn't it? And who's going to do that? And how are we going to make sure it's really happening? And how are people going to know that it's happening? Because that's our acid test, isn't it? At the end of the day, you know, how will people's lives improve?
Thank you. If it's okay, people, I've got 3 more people who've indicated, Robin, Kathy and Rob, so I'll bring those in, and then I'll ask Donna if there's anything she wants to reflect on from what she's heard, and then we'll move on to the second half of the paper and get Fatima to introduce that. So, Robin.
Yeah, thank you, Chair. I just my comments follow on very nicely from what Helen ended with, really, about how we can kind of get the impact of this work across. And just a huge thanks to Dame Donna and Fatima Khanis and the team for this. I was a part of the sessions, and what was really powerful was the stories and the experiences that were shared and the conversations that we had. And I think my plea would be that we commit to keep telling our stories, that we, as leaders, as colleagues, minoritized communities, as people that live in our places, that receive our services, and we keep listening to those stories, and we shout aloud that we are going to commit to listen and have those conversations. I think that right now, at this point, is quite important and quite powerful. I think it also, and this touches a little bit on the next item, so but I think there's something about that when we are talking about something that may be not connected in an overt way, that we make the connection and we connect the system to itself, as we often say. And the real example of that would be economic inactivity. Racism causes economic inactivity. You know, lack of psychological safety in the workplace means people, you know, have experiences that mean that they're unable to do their jobs and work, and certainly be well at work and feel well at work. So the system connecting to ourselves, and that we are a system that will keep pushing ourselves to do that, is pivotal. And I'll certainly do my best to make that commitment. I've just begun my term of solace president, so I'm speaking up for senior colleagues in local government and the 1.1 million people that still work in local government, despite the fact that it's a lot smaller than it used to be. And this is real, and you'll know just by the news of the last 24 hours how real it will feel for our colleagues right now. So thank you for the work, and I'll make the commitment to keep having these conversations, listening, learning and speaking up. Thank you.
Thank you. Kathy?
Thank you. Hello, I'm Kathy Elliott. I'm Chair of NHS West Yorkshire. Donna, thank you so much for your time and your consideration and your critical friendship to us. I think it's really important that we can see progress, but we also are challenged to do more. There's more to be done. So from my point of view, there are a few things here. I'm really pleased we're using the term social justice. I think that's incredibly important, rather than talking about perhaps a siloed equality, diversity and inclusion strategy or policy. I'd really welcome a review of practice. Fatima, I think this is something where we can create an opportunity for colleagues to learn from each other across places and providers. The inclusive recruitment toolkit, I'd really welcome understanding where people have used it well, or if they've used it and learnt a lot from it. You know, I have Fatima in using that. So I'd really welcome some case studies of people sharing what they've done well and what they've learnt from it. I think that would be great to help us all. And that goes alongside the Fair Work Charter as well. One of the themes and recommendations is around better incorporating lived experience in intelligence and data. And as you appreciate, local government and NHS are awash with data and reports. And it's something in chair of the Integrated Care Board members have been asking for at least 12 months now. Fatima, you're an advisor to our board. And there are a number of colleagues on the board who've been part of this review as well. So I think that's a fair challenge to us. Healthwatch challenges continuing on that. So I think we need to take that as an action ourselves. The other thing I want to share was something we're proud of. We've been working hard on increasing the diversity in our health and care leadership. There have been a variety of things. The fellowship programme is referenced as a very positive thing in our system. And I want to particularly thank chairs of boards, particularly NHS boards in our system, who've been working with me in increasing the talent pipeline of board members coming into the NHS and the diversity of them. We've worked together for about 15 months now. Fatima, again, you've been a critical friend on this. And Donna, it's great to see that we've got this talent that we're starting to see, and we're challenging each other as well, which is really welcomed. And our opportunity early last month was to do a virtual exchange with each other in the system, again, stealing ideas from each other, sharing best practice. But colleagues from NHS England regionally and nationally came and joined us, including the chair of NHS England, because they came to learn from us as a system. So I agree we're doing things well, but there's a lot more to do. So Fatima, please let me know how I can help. Welcome some case studies of good practice for colleagues and myself to learn from. And also we need to work further on our ICB board reporting to bring that lived experience in. But thank you very much.
Thank you, Kathy. And finally, Rob.
Yeah, so I've got two big points I think I want to make. So the first is that I sat in some of the sessions and I've had listening events with teams over the last few months, and I've often been moved by what people have said, and I've reflected afterwards that people have faced some real stresses, some real pressure, some outright hostility, racism and other issues. And, I've been moved by it, but I didn't have to live through it. And I didn't have to continue to live with it. And every time somebody's had to relay those stories, it's been at a cost. And I think there's something about us recognising the cost that's gone into telling us, engaging in and being part of this review for the people who've been affected. Because I think the people have to sort it out are us. It's not the people who are on the end of the racism and victimisation and the issues have to sort it out to us. And that's why I think what the report says quite gently, but I think we should hear very loudly, is this is an issue for all of us to sort out. And it's only by, the leadership of Robin or Kathy or others that this is going to get sorted out. So I genuinely think that's a big message for us. We are making progress, and we will make more progress, and should take the burden off the people affected and sort this out together. I think that the second is that as we move to strategic commissioning, the latest kind of jargon for what is commissioning, I think, this is what this work should be about. Strategic commissioning should be about this sort of work. It's how do we get data and intelligence from people in our communities to help shape the response that will make things better. So it's the same agenda. It's again to Robin's point, how are we connecting this explicitly back into the mainstream of our work, and always doing that. So thank you for those two big messages that are coming out of this, as well as all of the detailed work that's gone into it, and thank you to everyone who's been involved and affected by going through the review.
Thank you. Donna, would you like to come back on anything you've heard?
Yeah, I mean, I just want to say, when I first chaired this meeting, I wasn't convinced that everyone was convinced about it. And what shines through to me is the positive optimism that the whole of this partnership has. And if anyone can do it, you can do it. Now, we recognise it's not easy, and the world is changing, and we know that we're going to be up against it soon. We know what happens across the pond flies its way here, but it's people that make the difference. It's not them up there. It's how we can sell our message of hope, our message of optimism, the will to do something to the people that surround us. And for me, if any partnership can do it, I mean, I remember coming to my first board and thinking, well, there are a few voices in there that understand where we've got to get to. But actually this time round, I can honestly say, hand on heart, that all the voices in there know that we've got a lot of work to do. And the passion that has emanated from the people on this part, I should be thanking you, because it's not often when I'm doing this social justice type of work, and I somehow do a lot of it now, being chair of Runnymede, but it's not often that I can palpate the passion that I have felt throughout the last experience with you as a board. So it's not just, it's about the, you know, striving for the data, striving for the issues, looking together at how we overcome it. And I'm absolutely convinced, and I don't often say this, but I am absolutely convinced if anyone can do it, West Yorkshire can do it. You are the epitome of best practice at the moment, and people recognise you for that. So I want to thank you for the privilege of allowing me to review your review and for being here with you, because actually hope is going to be so important in terms of us getting things done. And everybody that I've come across, whether it's Ali, whether it's Fatima, whether it's Rob, whether it's Kathy, whether it's Helen, who have spoken on this committee, Kenise, who even takes the time to ring me and, you know, gives me some of her passion. I think that people have remained committed. Now, we can't do everything in one bite, but this is a journey. And if we put one foot in front of the other, my mum used to say, just one step at a time, Don, we will get it done. We will get it done. And I want to see West Yorkshire at a time when the world around us will change. But the commitment that's in this, palpable in this partnership, means that you will stay focused, you will stay tight, and you'll be committed to, you know, doing what we've set out to do. So I want to thank you, because it's been a real privilege being with you. And I'm going to be watching. Fatima, expect my phone calls. How are they doing? I will be watching from down south. So thank you all very much.
Thank you again. Thank you.
All right.
So I think I'll ask Fatima to come back in, because the next.
How on earth do I follow that, Chair? I'm not quite sure.
Well,
where we go from here.
This is the next step along the road, I think.
This is the solution, isn't it? This is, as Rachel Loftus says, this is the world. This is the act of hope in a world of despair. Let's focus on that, shall we? Ali and I were going to present our new vision for equity and fairness in West Yorkshire, but sadly she's been hit by a bug and has lost her voice. But she's here with the control of the slides, so we're still going to do a double act. And I think, Helen, this will address your feedback about how do we ensure that EDI is not something that's on the periphery of a system, but actually is part of everyone's day job and a golden thread in everything that we do. I think the first thing we say is that we recognise that West Yorkshire is not your average partnership. And I don't mean that in the context of we're brave, we're courageous. I mean that our data, our makeup is different to an average sort of integrated care system. We do have places that have some of the lowest decile of deprivation, as Sarah alluded to. And it's also a place that where you live and your heritage can impact your life expectancy. And we're leadership that will not stand for that, and we want to do something different. But in order to do something different, we've got to link it to our strategic aspirations of ensuring that wherever people live, they have the best outcomes possible. And as Donna has alluded to, we've been really good in some areas as a strategic system, but we've not quite met the Donna test, or as we call it, the Sheila from Hare Hills test, Donna, which is ensuring that the impact of our achievements reaches those grassroots communities. For example, Hare Hills, which is a district in Leeds. So what we wanted to do was to bring to you a new vision, a vision that articulates not only on what we can do collectively, but everyone's responsibility individually. And I want to do a special shout out to my incredible colleague, Sarah Smith, for giving us this title, The Power of One and the Power of Many. And the reason why that is really, really important was because one of the biggest elements of feedback we heard from individuals, particularly over the summer, but throughout our engagement, was that the time of rhetoric is over, the time of action is now, but supporting individuals to understand what is within their gift as individuals, as well as collective leaders of organisational institutions. And it's also a call to action. It's a call to action for a social movement of change, because we are in a society right now, as you've alluded to, Donna, where, you know, as an Asian Muslim woman, I am uncomfortable. I'm having to have uncomfortable conversations with the people in my life. And I never, ever thought in the 21st century that would happen. But I'm in a privileged position where I can try and influence change through incredible leaders like Tracy and Rob and every single member of this partnership board. So this is an opportunity for us to really facilitate and co-create what that would look like. The first thing is to really change the terminology. So we started our journey with the context of equality, diversity and inclusion, and we're moving now towards equity and fairness. And the reason why that is important is because we really need to recognise that not everyone in West Yorkshire is starting from the same place. So if you look at that image of equality, even if you level up, it still does not address the fundamental issue of inequality. So we really want to move towards equity, which is everyone getting the support that they need to improve their life outcomes. And we've had lots of conversations about that just with Fair Work conversations and the work that Jen's leading on. The other element is I am somebody that doesn't just settle for average, because why would we in West Yorkshire when you can have the best? And I think to truly address a fair West Yorkshire, we need to move towards the elements of justice and fairness and true inclusion. So justice is, if you've got a box in your way, instead of walking around the box, move the box out of the way. Really simple. And our vision for equity is to ensure that everybody who works in our health and care system not only understands the elements of equity, fairness and social justice, but is clear about what their role is in that space. If you are someone that is designing bus journeys in the combined authority, you understand what your role is when it comes to equity and social justice. If you are someone that is delivering health and care services or working as a receptionist to one of our trusts, you understand what your role is in equity and fairness. And the reason why that is important, if we move on to the next slide, is because we need to move away from just the protected characteristics that are mandated in legislation. We need to get into the power and the influence. And the reason why that's particularly important is because power can really impact people's lived experiences. It has the capacity to impact people's decisions. It has the power to impact who decides to get what? What do people get as a consequence? Power is a major factor in that. And this slide beautifully depicts how that might work. There's also something about recognising privilege and the fact that as a result of advantages, some people have more privilege than others. And until we start to recognise and address that, we will not move towards equity and fairness. And we discussed at the beginning of the meeting a conversation about artificial intelligence. That is something that will have power and privilege for certain people within our communities and our society. So just to talk through the process by which we got towards our final aspirations for equity and fairness, this just shows an overview of some of the conversations we've had with the public. And I think it's really important to articulate that we went through a really lengthy process with this, because we wanted to go to communities and people that have not had the opportunity to share their lived experience, and as Rob alluded to, have support to share their lived experience, but more importantly, to be able to co-create where we go from here. I think the other part is we are a data-led organisation. If you could move back, Ali, please. We are a data-led organisation, and all the decisions we make are based on what the data tells us. And that has been another attribute behind our decision-making of what strategic objectives we're going to focus on. An important element is also what we're already doing. So we're not starting from scratch, but we are evolving our approach away from just the facets of equality, diversity and inclusion towards justice, power and privilege. And then the final bit is making sure that we're amplifying the lived experience in a way where we also use the power of stories as well as the power of numbers. And we ended up, as you've seen in the document, if you go on to the next slide, with a list of a number of strategic objectives. And the reason why we framed it in this way is because they're not in a silo. So the leadership will impact the way in which we relate to our communities. And if you read the report, trust was a huge element of that feedback. Trust in whether they want to talk to us, trust in whether they want to use our services, trust in whether our staff want to share their lived experience with us and whether they feel psychologically safe to do so. Trust in the context of whether our communities will want to work with us to co-create the solutions. A key element of this strategy was rebuilding trust. And I think another part of that, as you can see at the bottom, is, you know, the mantra of Elvis that I keep saying to everybody, which is a little less conversation, a little more action. We're doing lots, but people don't always fully appreciate what we're doing and how it impacts the final outcome. And as a consequence of that, people feel disengaged. So we need to bring them back to the table. And then the final thing, which I wanted to share, because I'm really mindful of the time, Chair, and I know I talk fast and I want to make sure people have a chance to comment, is to really ask the Partnership Board for their help. So we have got a really great document, which I think co-creates with our communities and with our leadership the art of the possible. What we need now is the reality check of what we can do and who does what. Because without collective action, this social movement will not have the impact it needs to create a future that is befitting the people of West Yorkshire. So what we're hoping to do is to get your support in principle for this strategy. We then want to work with our places, which we've already started to find out what's already happening and we can include in the work plan. What we also want to do is ask other organisations to consider what it is that they can do to support the work that we're already doing, and then to find a mechanism which supports everybody's aspiration to peer challenge each other on their contributions, and to find a way of working in keeping of the values of the West Yorkshire Health and Care Partnership to support each other with some of the practical challenges of this journey. Because with power and privilege comes difficult choices and difficult decisions. And we're in a situation right now where choices are going to be hard. We have finite resources. And with power and privilege comes the opportunity to give support to others, which may require taking from some. And that might be something that we need to be brave enough to consider. So on the final slide, I just wanted to do a summary of the whole conversation because a lot has happened in these 46 minutes. I think the first one is to ask the Partnership Board to receive the report from Professor Dame Donna Kinnair and to consider the advancements as well as the recommendations in her evaluation of our independent review. The other ask is for us all as a Partnership Board to continue to embed these recommendations, not only in the equity and fairness strategy, but as the VCSE Voices and Donna has suggested, continue to embed that in the work of the Partnership Board as well, with the recognition that we need to continue that strong focus on equity in the context of race. There's also some specific recommendations for the fairness strategy. One is about noting and supporting the approach we've taken so far and really acknowledging the valuable input, not only of those with the lived experience that have contributed to our conversations, but also the staff and colleagues who have worked really hard to endeavour for us to turn around the review in 3 months, which is really quick for an independent review, but also the strategy, which was a real labour of love, in particularly from Ali. To endorse the objectives for the 5-year period and also to continue to promote and embed these strategic objectives as well as accepting the contribution it can make to improve our services. So in particular, recognising that in these really difficult times and our capacity constraints, what can we do to distribute the effort to ensure that we're all moving towards that collective goal? And then the final bit was, as I've alluded to, how we can best embed this new work that Donna's alluded to in the work of the Partnership Board, as well as the equity and fairness strategy. I hope that makes sense, Chair, and I'm going to stop there. Thank you.
Thank you, Fatima, and thank you particularly for pulling all the recommendations together at the end like that, which is really useful and powerful. I think the contributions we've already heard, hopefully from you know, myself as chair of this partnership, Kathy as chair of the ICB, Rob as the chief exec, Robin as one of the leading local government chief execs in the process, and of course Tracy as the mayor, helps to demonstrate the shared commitment that we've developed and are bringing to this. But let me open this up to see if there are any further comments or contributions people want to make, perhaps more focused on the strategy. Yes, Joe.
Yeah, thank you. I mean, it's really impressive piece of work and really good getting that external endorsement from Dame Donna on what West Yorkshire are doing. I think if I just had one reflection, I often, because I work on health inequalities, both in my role in West Yorkshire, but elsewhere. And I always think, if everyone agreed with us, this wouldn't be a problem. But sadly, people don't agree with us. And then I think there's something really important that we need to pay attention to, which is how we talk about it. Because if we talk about addressing inequalities in a way that risks alienating some people or running against some of their values, we then polarise. So I just would really encourage the team to think about some of the framing of this. I mean, there's a lot of evidence that shows that all populations kind of pretty much break down into people who think in what they call the kind of individualistic strain, who just think it's all about individual effort, determination, so on and so on. And then half the population think it's structural. And, you can look at that across so many different things and that same pattern comes out. And I would guess if we were to poll us, most of us would be seeing it through a structural lens. But the reality is there's an awful lot of people out there who see it through an individual lens. So I think it's great work. I think to have the impact we know it needs to have, really thinking about the framing of it in a way that engages rather than kind of polarises is important.
Thank you, Joe. Are there any more questions or comments? Tracy, thank you.
Thanks so much and brilliant work as always. Thank you. And certainly as the first ever female Metro Mayor in the country, diversity in leadership is a priority. And thank you for taking a lead also on the Solace Amplify leadership programme. I know that Calderdale, you've got the mighty Jane, small but mighty. But I know that she's an inspiration to so many in Calderdale. Also, we've had a really rigorous approach to our gender pay gap and ethnicity pay gap. And we've seen some good outcomes, but certainly on the ethnicity pay gap, we definitely could do more. And our big challenge is on disability. We really do struggle to get colleagues, to get people to want to apply to work for us and with us that have a disability, and what more can we do to make our organisation more attractive. So thank you for that. And also we've refreshed our recruitment processes, and we're taking another deep dive on how it's not just blind recruitment, there's also loads of other things we can do that are smarter and more innovative to make our organisation, which I mean, it's handling for the next 10 years, £7 billion worth of investment, our organisation diverse, to see those opportunities and see those gaps of who is getting the lion's share of all those investments. So thank you again for the leadership, and you've got a friend and an ally in me, and we keep shaking the tree, and we're going to make sure that we get change right to the very top, not just in those initial entry-level jobs to our organisation. Thank you, Fatima.
Thank you, Tracy. I'm not seeing any more hands, so really isn't possible to do formal votes on Teams meetings, and I'm not going to, but I hope I could bring Fatima in.
Thank you, Chair. So my apologies to interrupt you. It's hard on Teams, isn't it? I just wanted to check whether members of the Partnership Board were comfortable with the recommendations as I read out on the slides. So there's a specific ask about the way in which we report on these recommendations going forward. Is that to the Partnership Board? Is that via a different mechanism? And also a commitment for organisations to consider the strategic objectives in the context of their own organisations too. So I didn't want to presume, but I wanted to make sure that board members were clear on the ask. I can put the recommendations again in the chat as well for clarity.
I think yes. I was just going to say. I mean, I'm taking it to some extent. Taking silence as not just assent, but endorsement, and certainly want to see us do that. I think from my perspective, I think the partnership needs to demonstrate that we're continuing to take ownership and leadership. So I think we would want to see progress reported back here as what else is done. I wonder whether, bearing in mind we've done this over one or two issues, it might be appropriate for Kathy and I, following this meeting, to just write to member organisations highlighting the discussion and the recommendations. But I'll bring Rob in as well, because there might be some further perspective to bring.
Yeah, I think the work's good. I think the recommendations are right, and I think the conversation's been a good one. I think, Chair, we need to recognise Joe's intervention, which I think is a good one, in terms of how we use what we know to ensure that everyone's engaged in the delivery of the strategy. So some people will be driven by a sense of social justice in implementing this. Some people were driven by the fact that operationally we need to do better at supporting people in deprived communities if we're going to have fewer people pitching up at A&E or at the GP or whatever. They'll want to recognise this is just part of system flow, or the analysis tells us, and a bit more of a sophisticated approach on that is probably required for implementation. I think, judging by the nods around the room, that's something we should reflect in agreeing this. I think the other thing that's maybe implicit, which we might want to make explicit, is that by agreeing this, organisations will want to ensure that their own strategies and their own arrangements speak to it. So if people are revising their strategy, then they will need to make sure that elements of this are reflected in their strategies as a thread through. So I think those two things are important to add as well, Tim.
Thanks, Rob. Yes, and I agree. Welcome to take those in. Brandon, yes.
I think to Rob's last point, and I think point 6, so I am in support of this, but I need to take this back to my organisation for a proper conversation. Because I think this is, so we've been, you know, my organisation are cited on this, but I want to have a conversation with them rather than agree for them.
Thanks, Brendan. I think that ties in with Mariana's comments in the chat as well, that kind of formal request for people to take it back would be helpful. Thank you. So we'll make sure that those concluding remarks are reflected in the recommendations and the summary. And thank you again, everybody who's worked on this, and thank you everyone for the discussions. Fatima, final word.
I will not speak again, I promise, Chair. I just wanted to take this moment to thank everybody, the report authors, the team, and everybody who contributed to the review for their hard work, Sarah Smith, Gav, and everyone, because this was a real collective effort and a culmination of a lot of people's hard work and efforts, and it would be great to sort of publicly thank them for it. Thank you.
Thank you, Fatima, and yes, very happy to endorse that message to them. Okay, so item 10, again, building on our work around tackling inequalities, looks at the health inequality gap for children living in households with the lowest income. So I'd like to welcome Simon, Casey and Professor Peter Day to introduce this item. I'm not quite sure who's leading off first, so I'll...
Thank you, Councillor Swift. My name's Simon Mirza. I'm the Associate Director for Children, Young People and Families across West Yorkshire ICB. So, Councillor Swift, I'll kick off and then I'll pass over to my colleagues, Casey and Professor Day as well, to cover a bit more of the detail. So hopefully I'm taking the paper as read. Just reflecting on the conversation that's happened before we start presenting the insight into children. It's fantastic to be part of a system that's just got such a high level of ambition when we're thinking about social justice and inequalities and not losing sight of the things that matter for our communities, and hopefully the paper that we now cover demonstrates some of that sort of real change that happens in real work. So I also want to thank Sarah Smith's team as well for helping us with the inequalities data that this paper outlines. So as an ICP, Integrated Care Partnership, we know one of our ambitions is around tackling inequalities, particularly around the outcomes, experiences and access for our children, young people. This paper talks about one of our 10 big ambitions, which is about closing that gap, the health inequality for children living in households with the lowest incomes. And we've got some national policy levers that we can draw on to help us tackle some of those inequalities. And a lot of this work is framed around the Core 20+5 framework, which really looks at the most deprived of our communities, as well as those health inclusion targeted interventions we can take, and then some clinical areas that we can apply the approach to. I had the opportunity to talk to some young people this weekend. Our youth collective are running an event, and it was really striking in how keen they are to be involved in the change. They talked a lot about mental health, talked a lot about transition, access to services, and the shift where we were talking before about neighbourhoods, really trying to keep things local and early intervention. So I hope the paper reflects some of the work that we're doing that is in keeping with what our young people are asking us to also focus on as well. The ask of this board is to support that increase in visibility of children's data, inequalities data, and I know some work has happened across our partnership around making those metrics match the 10 big ambitions that we have across West Yorkshire for our population. We're also asking you to endorse the children's transformation priorities, which are identified through national policy, but also about what our local people tell us and data as well. A culture of mutual accountability, we were all invested in helping make a difference, reduce those inequalities, making sure the voice of our young people is front and centre, and particularly thinking about our diverse communities as well. Sharper focus on reducing inner health inequalities. I think sometimes we can get focused on too many priorities, and it's just bringing that back to some of the smaller quick wins that we can do to make a difference. Okay, so in terms of the Core 20+5, what the Core 25 framework asks us to do is reduce the over-reliance of reliever medications so that we can try and reduce the number of asthma attacks. In terms of diabetes, it looks at us increasing the access to digital technology to help our children and young people manage their conditions better. In terms of epilepsy, it's increasing the access to epilepsy specialist nurses, because we know that our children and young people and families have better experiences when they've got access to specialist training. Oral health and dentistry, a massive area of focus for us, and Professor Peter Day will come in and talk a bit about the work we're doing there. And then obviously mental health as well. The focus around the Core 20 is improving access to services. So I'll give you a really quick overview of what the data tells us, and then I'll just bring Casey in to give you an overview of some of those areas. So across West Yorkshire, 20% of our children and young people are under the age of 16. So we've got a young population which is higher than the national average. There's a variety of ethnicity, and what we see is approximately 22% of our children and young people's ethnicity is from a diverse background, and that varies across different places as well. We see the highest rate of children in care in our Bradford place, and that varies again across our partnership. And we've talked a lot about some of those inequalities that impact outcomes for not just children, young people, just our communities in general, around education, employment, housing, household income particularly, and other factors like smoking and poor diet. 21%, almost 21% of our children are recorded as living in those low household incomes, and we know poverty is a driving factor in some of the outcomes children experience. So I'll just hand over now to Casey, who'll cover the work that's taking place at that system, place and neighbourhood around asthma, diabetes and epilepsy, and then I'll just invite Professor Peter Day to talk about oral health as well.
Thanks, Simon. Hi everybody, I'm Casey Russell. I'm a project manager on the Children, Young People and Families programme at the West Yorkshire ICB. And I just want to come back to Core 20+5 for asthma, diabetes and epilepsy, and the significance of it being identified as a national priority, as that comes with an evidence base and recommendations for improvement from the national team. So our work has been done for us in a way, and I think what we've got to do is all get on the same page and understand what the challenges are for these children with long-term conditions. We know there's a high number of hospital attendances from the cohort of children who are from deprived areas, and I think this really clearly tells us that there are barriers to managing those conditions at home, at school or in the community. So the approach so far has been to work in partnership with our West Yorkshire places to try and drive change across these conditions. And one really important way of doing this is to build relationships with our places and align the priorities of children, young people and families with these conditions. Priorities can differ from bottom up and top down. We know that, but I think being able to have a shared understanding of the challenge will allow us then to springboard into improvement work. So I'll just go through the three conditions, give a little bit of background, a bit of context, and then assist what we're doing at system and neighbourhood level. So you'll know from the paper there's an estimated 1 in 11 children and young people with asthma in the UK, and although rates have decreased in recent years, in the UK, the UK is still one of the highest asthma mortality rates in Europe for young people. There's a recent national report that's been released on asthma and anaphylaxis deaths by the National Child Mortality Database, and there is a webinar on this next week for those that wish to attend. The outcomes for asthma are still not where we need them to be as a country or as a region, but we're working really hard as a system to try and change that or make an impact. We know environment plays a major role in exacerbating asthma, such as poor housing, indoor and outdoor air quality and access to green spaces. So from a system level, we have a children, young people and families asthma network of professionals from across sectors. We promote the use of asthma specialist nurses across West Yorkshire places. We also have an asthma friendly schools initiative that we offer support to initiate at local places. And I think one of the best moves forward we've made in this past year is the Children's Asthma and Housing West Yorkshire Principles. And we've worked really well with our strategic housing leads from each place. And we're nearly there across all the places to basically and simply improve communication between housing and health. Very simply for children who are going into intensive care, making sure that their home is not impacting on their health. And hopefully in the future we can roll that out so that meets the needs of more children and young people from deprived communities. At a neighbourhood level, I've got some examples of really good practice for asthma. So we're having young people's asthma reviews in high schools as a pilot in Bradford Place. Kirklees, we've had a brilliant home improvement project for children and young people with asthma. Leeds Place have a 48-hour review process for children coming out of hospital to make sure they don't go back into hospital. Wakefield Place have just finished their diagnosis in primary care, where a specialist nurse went into primary care to pick up on children who hadn't had their asthma reviews. Calderdale Place have funded asthma clinical input within secondary care, and I'll talk a bit more about that in a minute when I come to epilepsy. But next is diabetes, and what we have is a Right Care toolkit, and this is a national toolkit around service delivery. Type 1 diabetes is the prominent form of diabetes for children, and we've got around 36,000 children nationally with type 1. Type 2 numbers are much less, but it is becoming more common. In the recent past, we've had, for type 1, we've had some unwarranted variation in the medical technology, so hybrid closed loop and continuous glucose monitors, as well as insulin pumps. We've seen variation for those accessing that tech from low socio-economic backgrounds. However, the 2024 data is starting to show that ethnicity and deprivation gaps are starting to close now for access to technology. And this is life-saving technology, life-changing technology that allows parents of toddlers to be able to sleep at night, and also allows young people to be able to live a semi-normal life and have their diabetes under control. And hopefully this will bring down emergency admissions in the future. So from a system level, for diabetes, we've got something called poverty proofing training, which is really about that structural inequality, addressing that and bringing the workforce up to speed on what the barriers are faced by disadvantaged families who have children with diabetes. We have seamless diabetes transition training between paediatric and adult services. Again, how can we work jointly to improve the care package for these families? And we've recently had a system review called GIRFT, which is getting it right first time, and we have recommendations to focus on for our children and young people for diabetes. The neighbourhood level, we've got a fantastic family support work over in Locala for Kirklees and Dewsbury patients who speaks Urdu, and she supports families with the diabetes specialist nurse who have English as a second language. And that was a very reflective initiative of their population to say, what does our population need and how can we improve tech access for this cohort? Bradford Place are the ICB and public health working together to link in with specialist teams at BRI, and also adding training for both diabetes and epilepsy to the Living Well Schools programme. So, entering the realms of education and sharing training and resources with our schools colleagues. And last but not least, we've got epilepsy, and we have a national bundle of care for epilepsy and asthma. I didn't mention that, but there's an estimated 63,000 children with epilepsy under the age of 18 in the UK. In West Yorkshire, emergency admission rates for children with epilepsy are 112 per 100,000 compared to the average emergency admissions of 71 per 100,000. So that's quite a significant jump in our children and young people attending A&E due to epilepsy. From a system level, We've got a West Yorkshire epilepsy group. It's mostly clinical, doctors and nurses coordinating their response to improvement. We have a peer review. We have networks of nurses coming together to share best practice. And we are also focusing on assessing mental health needs of children and young people with epilepsy, and also them having individual school healthcare plans as a system priority. At a neighbourhood level for epilepsy, we've got a epilepsy nurse specialist pilot in Bradford and Airedale Hospital, and we are seeing significant improvements in safety and quality of families with complex health needs and comorbidities who've also got epilepsy. So we really hope that pilot continues after the pilot phase funding has come to an end. I'll just finish up. Sorry, that was my timer. Calderdale Place, I need to fly the flag for this because they were the first outside of Leeds Teaching Hospital to fund psychology support for children with epilepsy. This is huge and it's not happening on a national level, and it's part of all the recommendations and guidelines, and we need to make sure that this happens for children with epilepsy. And then just to tie up, Mid Yorkshire Hospital are doing some great work on education resources for emergency department staff around seizure management and medication, and Leeds Teaching Hospital have Enrich My Care app, which is about wellbeing support for families who are waiting for surgery and tertiary input. And this really changes things for children who wait a really long time to know what their future entails in terms of their mental health and treatment. So I'll come to a close now, but just to say that healthcare transition is also a theme that runs through all of these conditions that we are trying to work hard to change the tide on. Thank you. I'll hand over to Peter now.
Thank you, Casey. Can everybody hear me? Just check. Can you hear me?
We've got a bit of interference, Peter. Oh, that sounds better.
Okay, let's try again. Okay, so my name is Peter Day. I'm one of the paediatric dentists, and I have the pleasure of working in both Leeds and Bradford. In Leeds, in the community, in Leeds at the dental hospital, and in Bradford for the community dental service. So Sima has very kindly asked me to talk about the oral health and activities that the ICB are leading on. As a background, inequalities in oral health exists, with children from the most deprived communities having the poorest oral health. The latest National Epidemiology Survey identified that children from the most deprived areas are 2.5 times more likely to have tooth decay than their more affluent peers. And inequalities are not limited to deprivation, but persist across certain ethnic minority groups and children with disabilities. Key statistics include 11% of 3-year-olds have tooth decay by the age of 3, with an average of 3 teeth. By the age of 5, this figure rises to a quarter. In some of our most deprived areas of West Yorkshire, almost one in every 2 children has dental decay. Tooth decay is the most common reason for hospital admissions for children aged 5 to 9 nationally, and children from most socioeconomic deprived areas have the highest rates of hospital admissions for these extractions. Tooth decay significantly affects children's quality of life, causing toothache, sleepless night, altered eating habits, but it was also associated with lower school levels of readiness, child development, and poorer school attendance and performance. Fortunately, tooth decay is preventable, and prevention is focused around 3 key behaviours of brushing twice a day with fluoride toothpaste, reducing sugary foods and drinks, and improving and enabling dental access. Certainly, increasing access to dental services and reorientating dental services to preventive focuses are crucial. And to improve oral health inequalities, certainly collaborations across health, education, social care, as well as working with families, children and the community is key to reducing inequalities. So some of the activities that the ICB is leading on, as they are now in charge of continuing of dental services, is that since April 2023, there have been significant improvements in dental access with a focus on children, and the percentage of children accessing NHS dental services has grown by almost 10% to 60% in the last year. this has been invested in children's services, so including, in addition to the access schemes, there is a new scheme around level 2 paediatric programmes to enhance services for children, and funding of different oral health promotion programmes. Local activities are described in the report, but I'm just going to touch on a few of these evidence-based interventions which the ICB have led on. One is around habit, which is supporting health visitors to have effective oral health conversations, and is being rolled out currently in both Bradford and Wakefield, and is targeted for both high-risk families and as a universal access. Supervised toothbrushing is a national government priority and the Labour Party manifesto pledge, and the ICB has supported the rollout of supervised toothbrushing for children living in the most deprived quintile across the district or across the ICB. We're also working to support parents with young autistic children and resources around how they can undertake these preventive behaviours. And we have an activity for older children living in deprived areas around called Raised in Yorkshire, which is where sixth formers within these schools are supporting peers in their younger year 7 and year 8 age groups. So in conclusion, addressing oral health inequalities requires a multi-sectoral collaboration with a strong focus on prevention, and continued investment and targeted initiatives are essential to improve children's oral health and the outcomes for children and young people, especially those living in the most deprived areas. Thank you.
Thank you, Peter. And then Councillor Swift, I'll just wrap up. In terms of mental health, we've seen a huge increase in demand, and we've seen 1 in 5 children or young person having a probable mental health condition. We've also seen rises in neurodiversity and autism as well, and we've got long waiting lists, but there's some work happening across West Yorkshire that Sarah Smith and her team and Kia have supported us in pulling together to give you an overview of what's happening. So recognises variation in wait times across West Yorkshire. We know there's over 40,000 on a waiting list for 2 years, but there's a particular focus on sort of waiting well support during that time. Through that inequalities lens, we recognise that certain health inclusion groups are impacted further, so children that are care experienced, for example. And you'll see in the paper that it talks about focusing on meeting need early, particularly also we recognise the challenges around perinatal mental health as well. So the work that's happened across the system around co-production with local communities is a theme about how we work and build trust with our local communities. So some work in Leeds, the co-production about Thrive by Design and Leedsgate in trying to remove some of those barriers around access to mental health services as well. There's some work that's happened in Bradford around Healthy Minds apprentices, and that's really involving the young people in some of the work that we do. Use of technology, we've talked about AI before, but also using technology and apps to support children with anxiety, and having mental health support teams in schools as well. So some real examples of community engagement, as well as working with other sectors to meet children where they're at. I'll finish by talking a bit about measuring impact. It's often difficult when you're doing system work and there's a lot of partners working to try and reduce inequalities and to turn the tide on some of the trends that we see. We do that through a number of ways, though. We've got some hard data that we look at, and I know our system's done some work on some metrics against those 10 big ambitions. In terms of children, the framework that we use, Core 20+5, our metrics reflect those clinical areas and particularly focus around access to services, and hopefully we'll be able to break them down by ethnicity, gender, as well, to give us a better indication of whether we are turning the tide on some of the trends that we see. And then we also do a lot of work in trying to capture some of the feedback, because it's important to hear what our children, young people and families are telling us as well. And as I mentioned, the event that I was at this weekend, where young people were telling us how they really want to be part of that change, because it's not just about creating a better future for them, but the here and now matters for children. Children are young only for a short amount of time compared to our adult lives. So we need to really be focusing on what we do now to try and help them, as well as what we do in building a better future for them. So we'll stop there, and we've gone over a little bit of time, but I hope that gives the board some insight into the work that's happening to reduce some of those inequalities for children, young people and families, and happy to take any questions. Thank you.
Kathy,
Kathy,
Councillor
I think you
Swift put in the
I've just
chat.
seen the message. Yeah, sorry, I've just picked up that. Thank you very much, colleagues. Does anyone, Tracy, do you want to come in and respond on that?
Yeah, at the risk of extending this marathon meeting, which I don't know how you all concentrate. Good for you, and apologies if throughout the 3 hours I've missed something, but I do think it's incredibly valuable. But I would love to see you all in person, so hopefully that will be on the agenda at some point, that we could all meet in person. But I just wanted to pick up a couple of things that we know, that growing up in poverty is the biggest impact on health outcomes, and that there is the National Child Poverty Strategy. And I think we've got an opportunity where we can feed in about acknowledging ethnicity, and that cultural understanding as well is factored into that. So I think that's a really important challenge, and quite shocking. 112 per 100,000 go to A&E with epilepsy, and it's, substantially higher than the national average. So these sorts of data is putting strain, these sorts of outcomes putting strain on our NHS and crisis, I think is really important if we can understand why that's happening. And certainly when it comes to dental care, we know that the poorest and those from diverse families are more likely to have poor oral health. It's just not right. So as leaders and politicians, surely we can set the national agenda. But also, it is about that wraparound care, and very frustrating regarding the outcomes for Sure Start. We know that they had an impact on outcomes for young people, even through to their GCSEs. And it's something that we're looking at, even though it's not my responsibility per se, but leading on early years. I was the Shadow Early Years Minister when I was an MP, and I've seen some really great practice about how we can support families in those early years to get understanding of how to raise healthy kids, and those small interventions you can make that don't cost a fortune, but also to make sure on the other side that we have the best early years workforce. So I've invested using the what's called the apprenticeship levy share scheme. So Morrison's can't spend all their apprenticeship levy, it goes back to the Treasury, we keep it here because that makes sense. And being able to then, for example, fund the training and upskilling of 10 early years workers in a nursery, we know that that can also have good outcomes. So just to really support the work you're doing, thank you for being a great dentist. We need all the dentists we can get. So thank you for this work. And we do have a quite a unique position here in the MCA, that we can be quite helpful, I think, in supporting government thinking, and also having innovations and an approach here that's going to help children to get out and stay out of poverty.
Thank you very much, Tracy. Just to share with colleagues, as I temporarily chair the meeting for Councillor Swift, I've put in the chat box a report which Simon was involved in, working with public health colleagues, that came to the September NHS West Yorkshire Board, which was about our role as Commissioner. I was particularly interested in the board understanding that, and it complements very much, Simon, what you and colleagues have shared. Peter, I know you came to talk to us in April 2023 when we took on the dental commissioning contract as NHS West Yorkshire, and Rachel Loftus has also put the Child of the North report in, which is incredibly helpful and a good reference for us all. Rob, I'll hand to you, and Ian, I don't know, Ian Holmes, maybe you'd like to come in as well, just particularly on Peter's points on dental. Rob.
Yeah, thank you for the report and all the detail. I mean, I think there's so much detail in here and so much good work from that Casey, Peter, Simon have been covering that we can't do it justice here. I think what we can say though is some key points. I mean, the first one is that when we talk about integrated care and joined up services, we often default to thinking in our heads about older people. And what this report demonstrates is we have to think about children and families as much, and it speaks to the EDI strategy and the conversation we had about, you know, why do we focus on this stuff? Well, we've got a report here that says there's a statistically significant difference between morbidity and access by deprivation. That says that, you know, women and young girls have twice the rate of morbidity than young men, and that they're more likely to be conveyed in an ambulance because they've got a mental health issue that lands them in hospital. So we need to think about these factors. We need to think about joined up care. We need to think about children in the mainstream of our work. Having said that, we shouldn't shy away from the fact there's some good things happening. There appear to be some good things happening. So I'm really pleased that since we took on dentistry as a strategic or otherwise commissioner, whichever term you want to use, we have been targeting work at people who really need the support and making improvements. And I'm really pleased to see that, with still a long way to go. And we should also recognise, if you look at hospital admissions for mental health conditions for those under 18, all of our places are under the England average. And some of them less than half the England average. You know, most of them are at 50 per 100,000. The England average is 81. And then Leeds is at 38. So there must be something that we're doing, given the morbidity that we've got here. And that's a crude rate. I don't think it's adjusted for need. We must be doing something right somewhere in our system. And I think as a previous provider of mental health services, I think some of the other benchmarking suggests that. So what we need to be very curious about what is it that we're doing that seems to be working despite everything else, and how do we amplify that when there's so much more work to do? So I just wanted to make some of those points and recognise that there's so much brilliant work going on. We all never scratch the surface here, I think.
Rob, thank you. And I'd say, Peter, Simon, Casey, if there are key things that you can see that leaders can take on, we will be doing a follow-up letter in another part of the meeting. So I think anything on best practice, my question in my notes was, how do we mainstream a lot of this? Casey, you shared a lot of examples there. We want people, as Helen Hurst says, pinching with pride from each other to improve that practice, which would be really, really welcomed. I'll go to Mariana at Leeds City Council next, and then Peter will come to you.
Thanks, Kathy. I was going to make the similar point actually about the kind of scaling up, you know, particularly because obviously we've got the work that we're doing with Marmot, which, you know, gives you that challenge really around that poverty in its broadest sense, inequalities in the broadest sense, and how do you kind of scale up and be bold and take what is learning, you know, what learning we can from elsewhere and apply it, recognising that all of our communities are really different. So it's just that balancing act, I suppose. And, you know, the information in the conversation, understandably and probably rightly, is kind of flitted between the very narrow and the broadest, wider determinants. And I suspect most places have already got a child poverty strategy. And as Tracy said, you know, there's a national child poverty strategy that's emergent as well. So I wonder if we could do more to lodge some of this within those child poverty strategies in each place, that might actually help then in terms of that broader determinants and coalescing that work to have a greater impact given finite resources.
Mariana, thank you. That's really pragmatic and helpful. And Peter, before we come back, because I do have some questions as well. One thing you've talked about is asthma-friendly schools. Simon, you also came to talk to us about that at the ICB board meeting back in September. We currently have 950 schools, but only 160 signed up to the Asthma Friendly Initiative. I wonder what we can do as a partnership, and there's a number of incredibly influential leaders here today. And the other point in me supporting the Combined Authority and Tracy on places, housing and regeneration through the committee that the Combined Authority has, at their last meeting, they could see a rise in fuel poverty in households across West Yorkshire, and that is higher than the national average, and that is higher than Greater Manchester. I know there's some great work going on between our housing and health network, and they're looking at fuel poverty, but I think this is also something in our interests as well. So we are running out of time, and I can see that people are needing to leave to go to other meetings, but I'll leave you to sort of think that through. But Peter, I don't know if you want to respond on the points made.
I think it's very positive in that, you know, I work with a lot of colleagues around the country, and West Yorkshire ICB is very proactive and engaged, forward thinking. So, you know, thank you to colleagues who are part of the oral health plan. If we were very fortunate to write the Child of the North Oral Health Report, so there are some clear points to flag up and take forwards. And certainly, you know, I think it is a positive picture, but a long way to go.
So Simon, Peter and Casey, thank you so much. And I encourage you to sort of maybe some sort of simple points we could put in a follow-up letter that will particularly come from Councillor Swift, myself, with Rob's support. But we're really grateful to you for highlighting not only best practice, but what more needs to be done. Councillor Swift, you're back now. We have our last item 11. I know that we're overrunning and some colleagues unfortunately have had to leave, but we still have that item left in hearing from Joanne and Amy on the West Yorkshire volunteering strategy. I'll hand back to you.
Thank you, Kathy. Yes. Apologies for having to leave for a moment. And yes, so Joe, Becky, Amy, apologies, we are short of time and hence losing people, but can I invite you to quickly introduce this item for us?
Yes, thank you, Councillor Swift. I'm Jo Baker. I'm the Associate Director for Strategy and Transformation, and I will let my colleagues from the ambulance service and the voluntary sector introduce themselves as they come in as part of this quick, we'll keep it very quick presentation for you guys so everyone can get away. So just quickly, we're talking in the volunteering strategy about around 155,000 registered volunteers, probably double that if you count unregistered volunteers. This strategy is proposed for the whole of West Yorkshire, so for all partners. It's been developed by an integrated volunteering group which meet regularly. That includes hospital trusts, combined authority, voluntary sector, ambulance services, hospices, so really across the patch. It was endorsed by the West Yorkshire People Board in September of last year, and that followed 4 months of engagement with different organisations, sectors, and with volunteers themselves. So I was going to share a few slides, but I think in the interest of time, it might be wise not to do that and to take the paper as read. But just a little bit about our ambition, which is to strengthen volunteering across West Yorkshire, to encourage greater collaboration and join the dots, so to work where it makes sense to build on what's going on at place or within organisations or sectors, to join it up, to share and to learn and to build that work, and to align to what's going on in our places. We're only doing what's best done at West Yorkshire level and what organisations think will add value, and which we are much better doing together. This is also part of workforce planning. It's about pathways into work and pathways into employment, particularly for some of the groups we've talked about today who find it harder to access work and perhaps need to build their confidence and skills or see volunteering as part of their recovery journey. So I will just hand straight over to Becky, who is joining us from the voluntary sector, to talk to you about what the strategy priorities are. Becky.
Thank you. Jo, my name is Becky Bracey. I'm Volunteer Services Manager at Third Sector Leaders Kirklees. We run the Volunteer Centre for Kirklees and we're the infrastructure organisation. So there were 3 clear priorities that were identified as part of our consultation. The first being access and inclusion. So we want volunteering to be open to everyone and we want volunteers to reflect the communities of West Yorkshire. There are great pockets of good practice, but there are still significant barriers to recruiting people and retaining volunteers from all communities. The second priority is around value in recognition. Volunteering doesn't come free. Behind it sits volunteering professionals, good practice, shared learning. It's recognising the importance of volunteering as an element of our workforce. And the third priority is around volunteer experience. So where we have a great volunteer experience, that benefits the volunteer, the patient or service user and staff, our organisation. So you may reflect where you might have volunteered and had a good experience. For example, you might have volunteered on a park run and that might have been a great experience. So it's really important that we replicate where there is that good practice. We celebrate volunteering and what works well. I'll hand over to Amy now.
Thanks, Becky. Hi, everyone. My name's Amy. I'm the volunteer manager at Yorkshire Ambulance Service. So we just wanted to share that kind of part of this consultation, there was chance for people to suggest any additional areas that they felt we should think about as we plan the work to deliver this strategy. And there were 4 recurrent points that came through. A couple are around a couple of kind of physical tools, so things like a platform for promoting volunteering and practical toolkits for volunteer managers to support. And then general raising of understanding and awareness of volunteering and reducing the barriers to volunteer access and movement. There were also, it's worth noting, a couple of comments about more sustainable investment in volunteering, which we do hear a lot, and we know that it is a barrier to sustaining and continuing to develop volunteering. So essentially, we would just want to demonstrate that we have listened to feedback and we are considering how we can approach and include these things as we plan delivery. We did have a slide showing some feedback which will be circulated, but essentially we just wanted to share a few different quotes to really demonstrate the stakeholder reach and engagement. There was lots of energy from our partners around this strategy, lots of positive and supportive feedback. And from a YAS perspective, from a Yorkshire Ambulance Service perspective, it really reflects the ambitions of for volunteering at Yorkshire Ambulance Service, and it offers us that great opportunity to develop alongside our partners right across the system to the benefit of our shared communities. Back to you, Jo.
Thanks, Amy and Becky. And just to say, hospital trusts, and SWIFT, people like that have all now aligned to this strategy and to our volunteering principles for West Yorkshire, which are not really rocket science. They're good practice. They're what we should be doing to support our volunteers. So this really has already begun to spread out. And just to say, we are now working as a partnership group on a plan in how we will turn a lot of this into action. What does this really mean on the ground? How are we going to work with everyone on this? So that's underway, working across the partnership. So today, what we're asking for, on the assumption you have read the paper, because we've rather cut this short, to note the work that's taken place already and the engagement we've gone through to get to this point, to endorse the strategy, and to commit to strengthening the involvement of your organisations and the people that you represent in aligning to this strategy, and really collaborating and connecting with volunteering across our partnership and strengthening the way we work with volunteers. Because they're not just an unpaid workforce, they're actually adding huge strength to every area of work we have talked about today. So it doesn't matter what we've talked about today, there are volunteers contributing to delivering that. And I think that's really important for us to remember. They're a valued and important part of our workforce. So I'm really hoping now everyone will endorse that, but happy to take any questions.
Thank you, and sorry again we weren't able to offer you a little more time. There's been a lot of positive nods and comments as you've gone on, and a number of people who've had to leave saying they support the strategy as they go. So I've got Fatima and then Jen.
Unsurprisingly, Jo, I'm massively in favour of this. That won't shock you. I suppose my only bit of constructive feedback is sometimes volunteering opportunities can support continuous professional development and help people get into that next level. And when you're thinking about it from the diversity challenge and how we want to make our leadership more diverse, is there a way in which we can sort of align the two? So volunteering doesn't just support, you know, people's fulfilling their opportunities or supporting the organisation, but actually it's a smart move to get you to that next career goal. If we could even put that in, I think that'd be really great.
If I can just quickly respond to that, Fatima, we are actually currently working on an employee-supported volunteering strategy and programme for the West Yorkshire ICB, which would allow current employees to access volunteering within their work and look at that supporting their progression. So on the radar.
Thank you. Jen?
Thank you. I just wanted to take the chance to thank Jo for the involvement in the work health and skills plan and the alignment of this with that work. And you brought this to the Work and Health Partnership in its development as well. So we've had a chance to contribute there, and then also, you know, make sure that these two things aligned, because we really recognise that role that volunteering can play in skills and confidence development that support the Work Health and Skills plan as well. So just wanted to note that and thank you for the opportunity for us to connect these things.
Thank you. And Rob?
They're very supportive of the strategy, and recall at Leeds University through Professor Jane South did some groundbreaking work on the value of volunteering and volunteers to systems in terms of the skills and capacity that people bring, not just the additional pairs of hands. Just two thoughts really. One, implementation of, you know, a systematic approach to volunteering in organisations requires capacity. So we need to recognise that and work with organisations to see how that capacity gets put into place. And I think that I guess the West Yorkshire IVAG will do that with a people board. And then secondly, we're interested, aren't we? I thought in the strategy, the idea of people moving between organisation sectors more easily was a good one. Yeah. We're all looking at how we try and reduce our back office functions or consolidate them. Is there scope for us consolidating the support for volunteering within organisations by creating an infrastructure either in places or West Yorkshire that does it on everyone's behalf? Just something for us to think about when it comes to implementation. And generally, because we've lost quite a lot of people, and because I think this is so important, we might want to agree this here and follow up with a separate communication to people who've left or couldn't be here to say that's what we've done, so they can take it through their organisations, just as Brendan described earlier on the earlier strategy.
Yeah, that's a good idea, Rob. I think we should do that. Yeah. Kathy?
Thank you. I'm supportive of the volunteering strategy. It's something Jo and colleagues, I think, could we connect in with the national NHS volunteer scheme? And I'd encourage you to talk. You do. I'd encourage you to talk to my colleague Lauren Phillips, who, in a moment of winter pressures, found accessing the national scheme at that time rather. There were barriers in place, and I think there's just something in the volunteers recruited during COVID that maybe we can work with our colleagues in NHS England to better access. It's not a fault on either side, I don't think. I think we can just work with national colleagues. So that's an NHS matter. But talk to Lauren more if you want some more background.
Thanks, Kathy. And just to say, we do connect with NHS responders, with Help Force, with all the different parts of the system nationally and regionally. There is a challenge in terms of connecting volunteers across the two. We've tried really hard to challenge those and break them down, but at the moment we don't have solutions. So that sort of sharing of volunteers, and that is quite tricky, but we're on it and we will keep on it. Because we really do believe the best volunteering services are delivered by local people at place and in their neighbourhoods. So, yeah, a bit of a challenge on that one, but we'll keep at it.
Well, Jo, there's a whole group of senior leaders here who've got connections at a national level, so I would mobilise us to try and influence or even lobby that as well. Yeah, just give us a list and we'll go and lobby. I think there's a number of us here that might be able to help. Thank you.
Thank you. Thank you.
Thank you. So I'm hearing that we're very happy to endorse that strategy, and thank you for the work done on it, and we will use the partnership's resources to follow up and make sure it's properly shared and drawn to the attention of all our members. Thank you. And that brings us to AOB. And Kathy, I think you had something you wanted to raise.
It's in two parts, really. Just looking ahead to the integrated care partnership meetings for the new financial year starting in April. We're putting those dates together at the moment. We recognise that in planning today's meeting, for example, we're missing colleagues from 2 local authorities due to other commitments they have. So Tim, you and I have talked with colleagues about making sure that we map those meetings out. So we include everyone across local government, combined authority, NHS and the voluntary sector in these future meetings. The next one will be in April, and we're aiming to have that in person. So that might provide opportunities, as you say. And colleagues have said today in coming together to look at strategic plans and having a development session. And that then leads on to my colleague Laura Ellis, who works as our Corporate Affairs Director within the ICB. She undertakes every year for us, so has done for the last 2 years, an annual governance review since the ICB has been created as a statutory organisation, and this year very much want to include the Integrated Care Partnership, this forum, to make sure that we are adopting good governance practices. So that's everything from making sure we've got the right mailing list to effective meetings to the ways of working, decision making, which Tracy talked about earlier as well. So just want to flag that on the action list. Thank you, Tim.
Thanks very much, Kathy. Yeah, appreciate it. So thank you very much, everybody, for your time and contributions today. It's been a very, very full and important meeting. And just say thank you to the team who organise all of this. There's a lot of work goes into making sure this meeting runs smoothly. So thank you all, and we'll see you at our next meeting.